What does it mean for a hospital to be run by AI? China has already built the world's first AI hospital that diagnoses 10,000 patients in days with 93% accuracy, outperforming human doctors. This isn't science fiction, it's happening now. The gap between US and Chinese AI healthcare isn't just widening, it's becoming a chasm. Today, we're revealing exactly how China's centralized approach has propelled them ahead in the global AI healthcare race, and what these advancements mean for patients on both sides of the Pacific. Before we dive in, please subscribe to our channel, like this video, and turn on notifications to stay informed about our latest content. The world's first AI hospital, China's technological leap. How would you feel if your doctor wasn't human but diagnosed with remarkable accuracy? In China, this isn't theoretical, it's happening now. While Americans debate the ethics of AI in healthcare, China has quietly launched the world's first AI hospital, where virtual doctors are making real diagnoses with remarkable precision. This groundbreaking development comes from researchers at Tsinghua University who created what they call Agent Hospital. This isn't just software assisting human doctors. It's a comprehensive hospital environment staffed primarily by AI agents. The system leverages advanced large language models to create virtual physicians that can interview patients, analyze symptoms, order tests, and develop treatment plans with minimal human oversight. What's particularly striking is how this achievement challenges the long-held assumption that the United States leads medical innovation globally. While American healthcare institutions experiment with narrow AI applications, China has leapfrogged ahead with a fully integrated system that's already demonstrating impressive results. Consider Mrs. Liu, a 67-year-old with chronic joint pain, who recently visited Agent Hospital. After a conversation with an AI doctor, the system identified specific questions about her symptoms that led to a targeted diagnosis, all without ever seeing a human physician. The efficiency gains are staggering. These AI doctors can process and diagnose approximately 10,000 patients in a matter of days, a workload that would typically require human physicians about 2 years to complete. This exponential increase in diagnostic capacity could revolutionize how healthcare systems manage patient flow, particularly in a country with China's massive population. The hospital operates like a well-coordinated medical team, with 14 specialized AI doctor agents covering various medical fields, supported by 4 nursing agents. These virtual healthcare providers work within simulated consultation rooms and examination environments, mimicking traditional hospitals while eliminating human limitations like fatigue or bias. Perhaps most impressive is how these AI doctors continue to evolve. The Agent Hospital system incorporates continuous learning mechanisms, where AI physicians analyze their performance, study new medical literature, and improve their diagnostic capabilities autonomously. When tested against the challenging MedQA dataset, a standard benchmark for medical diagnostics, the AI doctors achieved a 93.06% accuracy rate, exceeding the performance of many human physicians on the same test set. What makes Agent Hospital truly revolutionary is how it simulates the entire patient care journey. From initial consultation through diagnosis, treatment planning, prescription, and follow-up care, the system provides continuity that mirrors the human healthcare experience, with patients interacting through natural language conversations. Government policy: how China's centralized approach accelerated AI healthcare. The remarkable capabilities of China's AI healthcare systems didn't emerge by accident or through market forces alone. Behind this technological revolution lies a deliberately orchestrated government strategy that most Westerners don't fully appreciate. While impressive AI diagnostic tools capture headlines, what's truly revolutionary is how China's leadership systematically created the conditions for these breakthroughs years before they materialized. China's coordinated approach began with the Healthy China 2030 initiative in 2016, a comprehensive plan to modernize healthcare infrastructure and expand access in underserved rural regions. This initiative specifically emphasized integrating artificial intelligence into cancer treatment, diagnostic imaging, and telemedicine. Building on this foundation, the 2017 National Strategy for AI Development aimed to establish global leadership in artificial intelligence by 2030, with healthcare as a priority sector. These complementary initiatives created a unified national direction with clear priorities and coordinated resources. Imagine the American healthcare innovation landscape as a puzzle with brilliant pieces scattered across private companies, universities, and healthcare systems, but missing the connecting framework that would reveal the complete picture. China's approach ensures research, funding, and implementation align toward common objectives. This centralized strategy translates to direct government funding and streamlined pathways from laboratory to implementation. Their current 5-year plan, 2021 to 2025, explicitly prioritizes research in medical imaging, AI, and personalized medicine. The effectiveness of this approach is evident in Beijing and Shanghai securing 19.3% and 14.6% market shares respectively in China's AI sector in 2023, positioning them as global innovation centers. Perhaps most consequential is China's approach to data, the lifeblood of AI development. The Personal Information Protection Law, implemented in 2021, establishes clear parameters for using patient information while maintaining privacy. For example, the law allows anonymized patient data to be used for developing diagnostic algorithms with appropriate safeguards. This regulatory clarity gives Chinese AI developers greater freedom compared to Western counterparts navigating fragmented privacy regulations. The result is a one-way flow of information that benefits Chinese AI development. While regulations protect domestic datasets from foreign use, Chinese researchers maintain access to publicly available biodata from around the world. Shanghai exemplifies this national strategy locally through its Medical Artificial Intelligence Development Plan, 2025 to 2027, focusing on accelerating innovation across drug development, clinical decision support, and intelligent surgery. The city's dedicated verification center validates AI applications for accuracy, ethics, and privacy standards. These centralized policies directly improve patient outcomes by accelerating the deployment of life-saving technologies. The government has implemented frameworks supporting medical AI commercialization that facilitate regulatory approval while maintaining safety standards, contrasting with the United States, where regulatory hurdles often delay implementation of similar innovations by years. Implementation at scale, from AI hospitals to rural healthcare transformation. While American regulators deliberate and pharmaceutical companies navigate approval processes, China has already deployed AI systems that diagnose brain tumors with 87% accuracy, outperforming teams of senior doctors by more than 20 percentage points. The BioMind system, developed by the Artificial Intelligence Research Center for Neurological Disorders, demonstrated this capability in a competition involving 225 cases, completing all diagnoses in just 15 minutes, while achieving 83% accuracy in predicting brain hematoma expansion compared to doctors' 63%. This performance difference represents real-world implementation, transforming patient outcomes across China's healthcare system. In one case, a 52-year-old patient with unexplained neurological symptoms received a life-saving diagnosis within minutes through BioMind, allowing surgeons to intervene before permanent damage occurred, a diagnosis that might have taken days through traditional channels. Unlike the American approach, where promising technologies often languish for years in regulatory review, Chinese hospitals have integrated these systems into daily clinical workflows with remarkable efficiency. DeepSeek, widely deployed across China's tertiary hospitals since January 2025, isn't sitting idle or being used experimentally. It's actively enhancing diagnostic accuracy and streamlining workflows for healthcare professionals daily, improving patient management while reducing cognitive burden on doctors overwhelmed by complex cases. The efficiency gains extend beyond diagnosis. AI-powered nursing assistants implemented across Chinese hospitals reduce nurses' maintenance tasks by approximately 20%, translating to annual savings of $20 billion. For patients, this means more personalized attention, as nurses can focus on providing direct care and emotional support that no machine can replicate. Perhaps most remarkable is how China has leveraged AI to address healthcare's persistent rural access challenge. In remote areas where specialists are scarce, AI-powered remote diagnosis systems function as digital bridges, connecting isolated communities to advanced medical expertise and reducing misdiagnosis rates by 63%. The Shanghai Health Commission's model as a service platform automates medical record creation and integrates AI applications into existing healthcare workflows, enhancing efficiency within familiar frameworks rather than requiring complete system overhauls. For clinical practice, the MedGo system provides quick and accurate diagnoses and care recommendations. Unlike experimental systems confined to research settings in the West, MedGo is actively improving healthcare quality in everyday practice. China's aging population benefits from AI-enabled telemedicine platforms, providing continuous monitoring of chronic conditions, detecting subtle changes that might otherwise go unnoticed until reaching critical stages. The growth in medical imaging applications has been particularly significant, with Chinese AI systems interpreting images with precision that often exceeds human capabilities, speeding treatment decisions and improving diagnostic accuracy across the healthcare system. Conclusion: looking beyond the technology race, China's leadership in implementing AI across vast healthcare networks exemplifies what's possible when technology meets scale. Their success stories, from rural diagnostics to AI-assisted surgeries, demonstrate tangible patient benefits that could address universal healthcare challenges. As Dr. Dylan Attard noted, MedTech World is committed to building bridges between Asia's dynamic ecosystem and our global MedTech community to drive impactful change in healthcare. This collaborative approach makes sense when examining growth projections. The global AI healthcare market is expected to reach $188 billion by 2030, with China's market growing at 23.5% annually through 2033. How might we all benefit if nations share these innovations rather than compete? Let us know your thoughts in the comments below.